4 tad gummy smile correction. Let's get into it. All right, this is Ashley. Ashley is a very dramatic case when it comes to gummy smile correction. She was a treatment coordinator of mine that saw what we were doing with our patients and jumped right into it and asked if she could be a patient herself. So it took her about 14 months to get a pretty amazing transformation. There's a couple other fun little highlights to this case that we'll get through. So if you just look at Ashley, you can see that she has a fairly decent upper arch, a little bit of crowding in the bottom, and just a tremendous amount of gum show. We figured maybe about an additional 5 to 6 millimeters more than we wanted with a high lip smile. Obviously, you know, there's limits to what you can do, but at the same time, we knew that we could treat quite a bit of this with our 4TAD protocol, along with using Damon Ultima braces to take care of the crowding and tooth positions. The other thing to note in this, you can't really see it on this photo too well because it's just really hard to retract back there for her, but her maxillary second molars were significantly over-erupted because of the loss of the mandibular second molars earlier in her life. She wanted to get some implants, so she had asked what she should do about that. The maxillary right was manageable. The maxillary left was pretty significantly erupted by about 5 millimeters. I was touching the tissue on the mandible. So, you know, we told her that we would see what we could do with that, but at the end of the day, if we had to crown lengthen it or let her have a root canal or even extract it, it's something that she could do. But you know, definitely we wanted to give it a go. Again, it took about 14 months, and you know, we were able to treat all of the issues in a beautiful way. So let me kind of show you how we did this. So phase 1 is always about foundation and direction. So, you know, we're going to use Damon Ultima. We're going to start, you know, getting some posterior lateral development, uprighting the lower buccal segments, and trying to manage some of this crowding. Now, because she was a team member of mine and I had a Friday open and I wanted to film some content, we kind of did a little bit of an aggressive start. Normally, I would start with an 0-4, then go to an 0-8 and place the TADs. But, you know, we had Friday off and she was good to go. So we went ahead and pretty much did everything in one day. So what we're going to do is we're going to talk about the lift protocol specifically for anterior posterior gummy smile. Now, with the lift protocol, it's basically our load-induced force technique that we use for any vertical change. In previous cases, we talked about vertical control with 4 TADs in the posterior to intrude molars. This is a little bit of a different protocol because you don't need palatal TADs. What we want to do is we want to place 2 8mm vector TADs simply between the first molar and the maxillary second bicuspid. Really easy place to place the TAD. Typically, patients that have a posterior and anterior gummy smile, they have a really large band of keratinized tissue. So you can really get those TADs pretty high up before the mucogingival line starts to make it complicated. The second 2 TADs are going to be 6mm TADs that you place between the lateral and the canine. Again, you don't need to start by diverging the roots because the mucogingival line is pretty high in gummy smile cases and the roots converge on themselves and basically move further apart. It's really easy to find the location for the TADs. And like I said, 90% of the time we can use a 6mm TAD instead of an 8 in the anterior. Now, what's interesting about this, and you know, Dr. Stu Frost taught me this, was, you know, I was using TADs on the palate, which was 6 TADs, and it was kind of complicated, you know, and he said, look, you don't need to do that. In gummy smile cases, as long as you're doing things very slowly, you could put flat plane occlusal stops on the lower first molars so that the palatal cusps of the maxillary first molars hit as a point to flat plane. Then every time you chew, you're adding about 80 grams of force to that palatal cusp. And theoretically, when you're lifting from the buccal, you can offset that rotation. Dr. Frost has his patients do chewing exercises. I think it's like 40 reps 3 times a day. You know, I just tell the patients just to get after it and chew. I build them up a little bit heavier, but it seems to work quite nicely. The key to it, though, is number 4. Activating these has to be very light. You want to activate them with 1 link of generation 2 power chain. That's it. If you start to activate it too much, then you're going to increase the force, increase the moment, and the teeth are going to tip out, and it really, really is difficult to recover. Then you'll have to place palatal TAD. So very, very light forces. You only need 20 to 30 grams per tooth to intrude. So we're going to add about 60 grams of force per TAD. This is what it looks like from the buccal. You can see between the first molar and the second bicuspid, and then right between the canine and the lateral incisor. Now, this is what it looks like in place. I really think that this is probably the easiest type of case to begin using TADs. All 4 TADs are very predictable. The keratinized tissue band is big. They're easy to place. There's lots of inner radicular room. It just works, and it's very simple. You'll see that as we start to treat this, we've got our wires in, and all we do is we treat the teeth with the braces. We go through our phases, and then we continue to tie the TADs posteriorly and anteriorly each time she comes in so that we can get a reduction of this gummy smile. Here she is at 5 months. You can see that we've already creating a little bit of an open bite, but we still need to pull in the posterior. And again, the only addition is on that maxillary left second molar. You can see I've got an extra TAD back there trying to lift up the palatal cusp so that I can intrude that tooth. Again, 5 months, we already have a significant reduction. We've already resolved the crowding on the bottom. Now we're going to get into phase 2, which is full expression, right? So we're putting in our 180275 wires. This is going to give us our torque couples on the anterior and posterior so we can start uprighting those lower teeth. And at the same time, we're still managing the gummy smile. Now, it is important to remember that as you're intruding the teeth, the gingival tissues start to fold over the tooth itself, and you get a shorter clinical crown. So you have to account for that. Essentially, when we get about 2 millimeters left, 2 to 3 millimeters left of gum show, we stop tying the anterior TADs, and then we tie them off in steel. And you could see that's what we did here at month 8. I just take a piece of ligature tie it around the wire or the bracket, and then I wanted to continue to tie the posterior because I was still intruding those 7s, and also there was an open bite. So I wanted to make sure that I intruded the posterior to let the mandible auto-rotate and really get us a nice occlusion. So this is 3 months. You can really start to see that even in a very complex case, these movements happen fast. Light activation every 6 weeks, and we're on our way. Here's where we went ahead and took the anterior TADs out. And usually when I do that, I'll give them a little anesthetic and do my laser gingival in the anterior. So you can see this is what it looked like when she came in. This is what it looked like when she left. Really looking good. About 6 weeks later, we were done tying the posterior. You can see the occlusion's nice, and even that maxillary left and maxillary right second molar are exactly where we want them. And that was the most surprising thing about this case, to be honest with you, was that I was able to manage that maxillary left second molar. And we'll show you the x-ray at the end. So here she is finishing up phase 3 records 1 week before debond. And you can see the timeline, right? Essentially round wire phase, rectangular. So we went with phase 1, foundation direction, phase 2, expression, phase 3 is finishing. I ended up with a TMA in the upper just because I was trying to finish some things and I wanted to do a few bends just because timeline was running light on her. She was going to be leaving our office and changing jobs, and we just wanted to make sure that she was finished up. So here she is final, 1 week after phase 3. You can see just such a tremendous change. No, she did not get lip fillers. She just, I think, was felt better, right? She wore a little bit more makeup on her lips, and I think when you have a very large gummy smile, you don't really want to attract the look to that. Subconsciously, you don't want people to see it. So now that we were managing that, it was treating beautifully. I think she was just really, really proud to show her teeth. So much so that I think it changes sometimes the people's outlook on who they are. I always tell people when we do gummy smile correction that it's a significant change, and psychologically you have to be ready to look a little bit different, because as I started doing this, I noticed that some of my patients they were a little uncomfortable with how much change it was. People asked them if they had jaw surgery or truly sometimes didn't recognize their smiles. So, it's always okay to be a little bit confident and say, look, there's going to be a significant change in your gummy smile. So hopefully you're good with that. Again, before and after, you can see, looks like a very, very different person. We'll go through these pictures really quick. Again, using Damon Ultima, we were able to really control the 3D position of these teeth. Using the TADs, we're able to intrude not only the second molars, but also the maxillary arch so that we could get a reduction of gummy smile, and then let that mandibular arch auto-rotate so that we could also end up with just a really beautiful lower face third. So again, those second molars, super surprised, roots look perfect, and she can go ahead and get her implant restorations on the bottom now. If we look at how significant and how just beautiful it's treated out, this is something that I was inspired to do by Dr. Frost back in probably maybe 2009, 2010. And I remember after I saw his cases, I said, look, I can't unsee this. And I went back to my office the next week and saw a Gummy Smile case and put the TADs in and started treating. And, there is a learning curve, but it's getting a lot easier, especially with a full expression system. We used to have to do a lot of detail bends to get the teeth in the right spot, but, now it's very, very straightforward. Again, kept the profile, even though we managed a lot of crowding. Her lips look even better. And that is just absolutely something that I'm super proud to be able to offer as a service in our practice. So if you look at the macro, the mini, and the micro aesthetics, just absolutely fun to be able to do this. Again, 14 months. So if this is something that you're interested in, we're going to be posting a lot of these cases. Check us out on YouTube. Look at our website. We've got a lot of options as far as courses and TADs and laser in-office courses that we kind of throw. And more importantly, if you like this, please send it to your friends. Hopefully, this is informative and you had fun with it as much as I did. Take care. Bye-bye.